Global statistics has it that in Nigeria alone, prostate cancer is the third leading cause of cancer death in Nigeria, with over 950,000 new cases and 72,000 cancer deaths since 2012.
We reached over 10,000 men, and reached over 15 million people indirectly through television, through social media, and other campaign strategies. And out of the over 3,000 people that we mobilized for this program, about 1,661 who received, about 1,661 men received the prostate cancer screening from this number that we mobilized. And interestingly, from the 1,661 men that were screened that received the prostate cancer specific antigen test, about 129 men were found with high levels of PSA, which is, we're using the PSA level for 4.0. That is like 7.8 of the entire study, of the entire people that participated. 7.8% of the entire people that participated in this study. And you see, out of this same number as well, we now try to further analyze the results and also try to follow up. Because one thing is providing a screening, and then what next? So we didn't just provide the screening and saw them with abnormalities and we left them. We also follow them through treatment and otherwise. And then we found out, these are the following findings that we had from this study. We found that most of the respondents, about 70% of the people who participated in this study, actually, pay for their healthcare service out of their pockets. Only 14.5% and 4.2% are covered by health insurance and their organizations, respectively. This highlights the challenge facing Nigerian healthcare system. With only few people having access to health coverage, our findings reveal that most Nigerian men have to pay for essential healthcare, from their pockets, as they do not have any health insurance coverage. This as well slow our push to detect prostate cancer early in men, as well as also discourage men from seeking professional health care and attention due to financial burden. In this study, we provided PSA tests free of charge to all the participants. But however, we all know that prostate cancer specific antigen tests cost about 6,000 to 11,000 and even more, depend on the facility where the man actually goes for screening.
This was made known by Project Pink Blue as a research on prostate cancer awareness in Abuja. The agency calls on the federal government and local governments to take necessary steps in making sure proper health checks and screenings are given to persons with prostate cancer.
936 men who voluntarily screened for PSA for prostate cancer in Nigeria cities. 639 men complied with comprehensive response to the interview. 18% of the screened participants could not respond because they either provided incomplete phone numbers or they could not be reached after 3 repeated trials. On the provided phone numbers, 22% declined being interviewed on their results and progress. Regarding attitude around their screening and treatment behavior, 67.2% of the men reported that they foresee no impediment to future screening and treatment. Factors reported to possibly prevent people from future annual screening. We are remembering to go for screening, 4.5% of them, and also work, which is 1.4% of the men. Some men were also not sure if they will be doing the next screening. While most participants appreciated being followed up, there were notable differences in how some men followed up with the need for further assessments and treatments. At the time of follow-up calls and interview, 3 months after PSA screening results were delivered, not all participants who required further screening, that's PSA score greater than 4, have gone to the recommended centers and doctors. More than half of the men indicated that they will be willing to pay for their screening in the next year. 10.5% will go for the screening if affordable.
It is hoped that this awareness will help promote prostate cancer risk factors and early detection in Nigeria. Magdalene Palmer, Voice TV Nigeria.